My patient's name is Megan Brown. She was born on 3/25/1976. She's a female. She came into the ER, complained of pain radiating from her chest to her left shoulder and jaw. She said that she was throwing the ball to her grandkids in the backyard when she immediately started experiencing shortness of breath, lightheadedness whenever she stood up too fast, and nausea. She said she sat down thinking the symptoms will go away, but it gradually worsened. So her history of present illness, she said she has noticed she gets short of breath when she does any physical activity, as well as jaw pain for the last week, and it's never happened to her in the past. She also states the pain in my chest has constantly worsened to the point she can no longer do any type of physical activity. The jaw pain keeps her up at night, and she said that she just takes ibuprofen for it to, in hopes of feeling better. Her pain scale from 0 to 10, 10 being worse, she said it's a 7 out of 10 in her chest. She said it hurts in her jaw, her chest, and her left shoulder when it's radiating to her shoulder. She states it's hard to breathe when she moves or walks. I asked her what it could be, and she stated that she has Googled all of her symptoms and she's afraid that she's having a heart attack, but she's not sure. So the review of symptoms, the chest, she is positive for shortness of breath, negative for any physical injury or asthma or recent surgeries. She is, for her arms and legs, she's positive for pain in her left shoulder. She has normal range of motion, no bruising or discoloration to the left shoulder. And then she has pain in her jaw that radiates to her shoulder. Her past history is that she smoked cigarettes for 4.5 years, but she recently stopped. She does take ibuprofen 200 milligrams PRN for the pain, the melatonin 3 milligrams QHS for sleep, and then I'm just a multivitamin each day. Her past medical history is that she's had a cholecystectomy 2 years ago due to gallstones. She is allergic to latex, iodine, peanuts, and penicillin. So her mother did have breast cancer, and her father did have a recent MI 13 years ago. He also has cardiomyopathy and COPD. She drinks alcohol maybe once a month, and it's only beer and no other type of alcohol. She has 2 kids, and both of them have had no cardiac symptoms thus far. Her vitals, her respiration was 18, her pulse was 98, her blood pressure was 106/77, her temp was 98.7 degrees Fahrenheit, and her O2 was 97% on room air. She's AAO times 4. Her lung sounds are equal, bilateral, and clear to auscultation. She has a noticeable heart murmur with abnormal rhythm. Her cap refill is less than 3 seconds. She has strong and bounding peripheral and pedal pulses. Normal skin turgor. Her height is 5'6". She weighs 213, so she is a little overweight. So what I did find is that to help support the diagnosis is that she smoked cigarettes for 4.5 years. She is overweight. She has an unhealthy diet. She has a past history of an MI on her paternal side. The test to order is cardiac enzymes and her troponin levels to see if she is having a current MI or not, an EKG, cardiac cath, and then an ECG. The medications that she will probably be on if she is having an MI is warfarin, aspirin, metoprolol, and furosemide, and we're going to stop the ibuprofen. And then we're going to teach her about healthier diets and then to reduce any unhealthy fats or sugars. And then any possible surgeries she could have is any stents placed to unclog the arteries, or either a cardiac bypass surgery. It just depends on how many arteries are clogged in her heart, to see if she needs the big surgery, that big major surgery. Thank you.